Let's talk about a common issue that affects many men, erectile dysfunction, or ED for short. This condition can be a source of significant stress and anxiety, but understanding it better can help alleviate some of that burden. Simply put, ED is when a man has trouble getting or keeping an erection firm enough for sexual activity. This can be a frustrating and embarrassing issue, but it's important to know that you're not alone. Many men experience this problem at some point in their lives. It's important to remember that occasional difficulty with erections is normal. Stress, fatigue, or even having too much to drink can affect your ability to get an erection. However, if you find that this is happening more frequently and consequently affecting your quality of life, it might be time to look deeper into the issue. Persistent erectile problems lasting more than 6 months can be a sign of underlying health issues that need to be addressed. Ignoring the problem won't make it go away, and it could potentially lead to more serious health concerns down the line. It is important to check that the patient is actually describing ED, which means poor quality erection rather than decreased libido, Peyronie's disease, penile curvature, or ejaculation problems. There are several reasons why ED can occur. Understanding these reasons can help you and your doctor find the best treatment. Sometimes it's due to physical factors like heart disease, diabetes, or low testosterone. If you have complaints of numbness in the penile or scrotal area after cycling, these conditions can affect blood flow or nerve function, making it difficult to achieve or maintain an erection. This is called organic ED. It's often related to physical health issues that can be diagnosed and treated with the downstream benefit of improving erectile dysfunction. Other times, stress, anxiety, or relationship problems might be the culprits, which we call psychogenic ED. Mental health plays a significant role in sexual function, and emotional or psychological issues can be just as impactful as physical ones. Certain medications, like antidepressants or blood pressure drugs, can also contribute to ED. If you're taking medication and experiencing ED, it's important to discuss this with your GP. They may be able to adjust your prescription or suggest alternatives. Each case of ED is unique, and finding the right solution often requires a comprehensive approach. The good news is that ED is often treatable regardless of the cause. There are many options available, from lifestyle changes and medication to therapy and medical procedures. The first step is talking to your doctor. Open and honest communication is key to finding the right treatment. Your doctor can help you understand the underlying causes of your ED and work with you to develop a treatment plan. They can help determine what's going on and recommend the best course of action for you. This might include lifestyle changes like exercising more, eating a healthier diet, or quitting smoking. In some cases, medication or other treatments might be necessary. Remember, you're not alone, and there's no shame in seeking help. Lifestyle changes can have a significant impact on ED. Regular exercise improves blood flow and can help reduce stress, both of which are important for sexual health. Eating a balanced diet and maintaining a healthy weight can also make a big difference. Weight loss can reverse ED in 30% of men. Managing stress through activities like meditation, communicating, or spending time with loved ones can also help. Mental health is closely linked to sexual health, and reducing stress can improve your overall well-being. There are also medical treatments available for ED. Medications like Viagra, Cialis, and Levitra can help improve blood flow to the penis, making it easier to get and maintain an erection. These medications are often very effective, but some may require a prescription from a doctor to access them. Other treatments include vacuum erection devices, which use suction to draw blood into the penis, and penile implants, which can provide a permanent solution for severe cases of ED. Your doctor can help you understand the pros and cons of each treatment option. Communication with your partner is also crucial. ED can be a sensitive topic, but talking openly about it can help reduce anxiety and improve your relationship. Your partner can be a source of support and understanding as you work through this issue together. Therapy can help address any underlying psychological issues that may be contributing to ED. Erectile dysfunction is a common issue that many men face, but it's important to remember that it's treatable. By understanding the causes and seeking appropriate treatment, you can improve your sexual health and overall quality of life. You might be surprised to learn just how common ED is. Erectile dysfunction, ED, becomes more common as men get older. Around 60% of 60-year-old men experience ED, and half of them have severe symptoms. It can also affect men in the younger age group. ED can often present only in situations due to performance anxiety. There may be feelings of dread around sexual situations. The symptoms are erratic and change based on the situation you are in. For example, erectile problems in a newly divorced man in a new relationship for the past 7 months, who is still feeling guilt from previous relationships. This presents as loss of confidence and poor erections in a sporadic pattern. When ED is an ongoing issue, it's often due to lifestyle factors, medicines, or hormonal deficiencies. Ignoring ED won't make it go away. In fact, it can sometimes be a warning sign of other underlying health problems. The good news is that by addressing ED, you're also taking a proactive step towards protecting your overall health. ED isn't just a physical issue. It can significantly impact a man's emotional well-being and relationships. Imagine feeling frustrated, embarrassed, or even anxious about your performance in the bedroom. These feelings are entirely understandable and common among men experiencing ED. ED can also strain relationships. It's important to remember that open communication with your partner is crucial. Talking about your feelings and concerns can help you both feel more supported and understood. Remember, you're not alone in this journey. Seeking help for ED is a sign of strength, not weakness. By addressing the issue, you're taking a positive step towards improving your quality of life and strengthening your relationships. Taking that first step towards getting diagnosed with ED might seem daunting, but it's easier than you think. Many men feel anxious or uncertain about seeking help, but understanding the process can alleviate some of that stress. It's important to remember that you're not alone in this journey. Millions of men experience ED, and seeking a diagnosis is the first step towards finding a solution. Start by scheduling an appointment with your primary care physician. This can be done over the phone or online, depending on your clinic's procedures. When you call, let them know the reason for your visit so they can allocate enough time for a thorough consultation. Your primary care physician is your partner in health and can guide you through the process. They have the expertise to help you understand what's happening with your body and what steps you can take next. Building a trusting relationship with your doctor is key, as it allows for open and honest communication. During your visit, your doctor will ask you about your medical history, any medications you're taking, and your lifestyle habits. They may ask about your diet, exercise routine, and any stresses in your life. It's important to provide as much detail as possible, as this will help them make an accurate diagnosis. Be open and honest with your GP. Discuss any symptoms you're experiencing, even if they seem unrelated. Your doctor may also perform a physical examination and order tests to rule out underlying conditions. Some of the important physical examination and blood tests include blood pressure measurement, rectal examination, and examination of genitalia. Tests are aimed at excluding other disease as a cause of ED and assessing cardiovascular disease risk. There is higher risk of cardiovascular disease in patients with erectile dysfunction, for example, diabetes, high cholesterol, low testosterone and metabolic syndrome, and hypertension. The first-line testing for all men is to assess CVD risk and diabetes as underlying cause. Most GP systems will include requests for a PSA and testosterone. Blood samples for testosterone must be taken before 11 a.m. to avoid an artificially low result. If there are too low testosterone results, under 8 nanomole per liter, test for causes of persistently low testosterone. Check prolactin levels, free androgen index, sex hormone binding, globulin, follicular stimulating hormone, and luteinizing hormone. When it comes to managing ED, your GP would try to work out the contributions of both psychological and organic causes. It's not just about the physical symptoms. Understanding your sexual history helps your doctor get a comprehensive view of your overall health and well-being. If appropriate, interventions to help include lifestyle changes like stop smoking, increase exercise, and lose weight. Other important changes include advice on quantity of alcohol consumption. Your GP will conduct a medication review and consider stopping or switching drugs that can cause ED. They might also inquire about any difficulties you have reaching orgasm, any pain during intercourse, or changes in your sexual desire. These details can provide important clues to offer recommendations. In the young male, having another erection soon after a recent ejaculation can increase the duration if the rigid erection phase. Don't be afraid to be completely open and honest with your doctor. This is a safe space where your privacy is respected. The more transparent you are, the better your doctor can understand your situation. They've heard it all before and they are trained to handle these conversations with sensitivity and professionalism. Your honesty is key to finding the right treatment. Following first-line testing and cardiovascular risk assessment, your GP can offer phosphodiesterase 5 inhibitors. 80% of recipients respond to phosphodiesterase 5 inhibitors regardless of the cause of ED. Examples include Viagra, Cialis, and Levitra. All phosphodiesterase 5 inhibitors have similar efficacy overall. With the exception of generic sildenafil, the other formulary drugs like alprostadil, tadalafil, vardenafil, Viagra, vacuum devices for the treatment of erectile dysfunction may only be prescribed on the NHS under certain circumstances. Patients who are not eligible for an NHS prescription and those for whom generic sildenafil is unsuitable can be issued with a private prescription by their GP. The side effects are similar in all three. Although the side effects are not common, headache and flushing is the commonest reported. Dyspepsia or indigestion, even when reported, is not usually problematic. Rare and transient side effect is visual disturbance of color and light sensitivity. There are specific NHS prescribing restrictions on GPs for the treatment of ED. This means that referral to access medication or other interventions will need to be considered earlier for some groups of patients than others. For patients eligible only for generic sildenafil, consider referral for men with a normal testosterone who have failed to respond to 8 doses of generic sildenafil at maximum dose with sexual stimulation. For other men with a normal testosterone, which is likely to be the majority of men, consider referral for those who have failed to respond to 8 doses at the maximum dose with sexual stimulation of 2 different phosphodiesterase 5 inhibitors. Other criteria for referral include: refer patients with persistently low testosterone under 8 nanomole per liter to endocrinology. Refer patients with Peyronie's disease to urology. Refer patients who are suffering severe distress as a result of impotence. Refer those in whom phosphodiesterase 5 inhibitors are contraindicated for consideration and training of other therapies. I hope you found this helpful guide. Don't forget to like, share, and subscribe to the channel for more educational videos like this.